thank you for joining us here on our virtual town hall session. And we are super pumped that we have Miss Carolyn here and for Shatterproof, wherein we will discuss addiction treatment and Locator and their Locator assessment platform. This is really important right now because, I mean, as much as we want to be positive in spite of the health challenges that we're all facing given COVID-19 and all the other things that is bearing not so good fruit because of that. And one of them is using substances that may not necessarily be beneficial for us in the long run, and at the same time that is not, or using a little bit more even if it's prescribed than what we should be using. And with that reality, we need to go ahead and identify what's the available help and assistance out there so we can help ourselves and our loved ones who are facing such dilemma. So hopefully, was that a good introduction right there, Carolyn?
That is fantastic. Yes, exactly. You hit all the major points.
All right, wonderful. So, all right, given our circumstances, what do you want to go ahead and share first? With what, yeah, whatever you want to share.
Sure, sounds good. And let me know if I'm a little choppy. My internet is a little bit funky. So I'm here today to talk about the launch of Atlas, which, as mentioned, is our virtual addiction treatment locator assessment and standards platform. And so this is an exciting new website that we launched in July. You can go to treatmentatlas.org. And it's now available in 6 states. And we really just want to get the word out to as many people as possible who can benefit from this platform.
Sounds good. And that's why we're doing this, because with these virtual town hall sessions, we're inviting guests who are subject matter experts with this COVID-19 twist. And again, this is really critical. Especially we're limited of visiting places of just dropping by, if you may. So I know you already mentioned that. Care to explain a little bit more of what Atlas is and what does it do and how it can help people?
Sure. So right now, it's very difficult to find addiction treatment for those who need it. So even working for Shatterproof, I have trouble finding treatment. For instance, I have a friend who's really suffering from alcohol use disorder, and I didn't know where to turn to. I didn't know where to look. I knew she needed some place that took Medicaid, but if you go online and search addiction treatment, what you'll see is a bunch of ads for, say, luxury treatment facilities, which isn't necessarily bad, but these treatment facilities often don't follow evidence-based best practices for addiction treatment. So the reason that that's an issue is that bad addiction treatment can actually do more harm than good. It can cause people to relapse, it can cause people to overdose. And so it's really important that facilities are following what the evidence shows is effective at reducing relapse, at improving patient outcomes, at improving patient health. So the aim with Atlas is to create a system where patients, family members, anybody interested in finding quality addiction treatment in those 6 first states, which I'll describe later, can go online and look up treatment facilities near them and see how these facilities measure up in terms of providing evidence-based best practices. And then Atlas is also really great because it allows patients to leave feedback. It allows providers to access more detailed data so that they can make quality improvement changes at their facility. And it's also a not-for-profit website that's not funded by treatment providers, so there's not that conflict of interest there. It's made with patients, loved ones, and providers in mind.
Wonderful. And if you don't mind, I'll highlight 2 phrases that you have shared. One of which is the importance of evidence-based programs. It's not just a matter of how fancy the place is or what have you, but what actual programs that would really help and assist individuals who are suffering as such. And the other phrase there too is that I want to highlight that you mentioned is that it's nonprofit. So as you mentioned, there's no conflict of interest because we can easily make magic out of certain things. But if you are independent and really identify what programs that are available and that will actually work or have a strong probability of working, then that's what we should be highlighting. So thank you for that. And yeah, again, we're really blessed to have really solid guests here, and here we are with Carolyn. So you mentioned earlier 6 states. Can you identify what states are those, and possibly expanding in other areas?
Sure. So right now we're mainly along the eastern seaboard, I'll say. So we're in Delaware, Louisiana, Massachusetts, New York, North Carolina, and West Virginia. So what that means is that anyone in any of those 6 states can go on to treatmentatlas.org and use the website to locate and compare addiction treatment facilities in terms of their quality and patient feedback. For those in other states, they can still go to the Atlas website to learn more about what to look for in quality addiction treatment and how to select an appropriate treatment provider, how to navigate insurance. But as you touched on, we are looking to expand. So these 6 states are just what we call the first phase of Atlas. In the second phase, we hope to expand to 3 or 4 more states. And so if people are interested, if they want to bring this platform to their area, we highly recommend them to reach out to atlas@shatterproof.org so we can talk further.
No doubt. And we should really, yeah, hopefully you guys are able to proceed with that and be of that assistance to individuals, of such individuals again, and their loved ones. So you mentioned earlier it's free and it's of no cost. So care to explain the process? I mean, yeah, you mentioned of going to the website, but what else do we do? For example, if I know somebody that's close to me, what else do we do?
Sure. So the way that Atlas works really is when you or a loved one or really anybody you know might need addiction treatment, they go on the website. There they can take a very simple assessment that will tell them the level of care most appropriate for themselves or their loved one. It's just 13 questions. It's completely anonymous. At the end, you'll get a result that lets you know what sort of treatment may be most appropriate. This isn't intended to take the place of a doctor's assessment, but instead gives people the information so that they can start the process of searching for treatment. But that can be really intimidating if you think, okay, I know that I have an addiction, or I know my loved one has an addiction, but I don't know where to go. So a lot of people think that addiction treatment is just 28-day rehab, that a patient goes to a facility for 28 days and they come out and they are cured. In fact, addiction treatment is more of an ongoing process, and there are different levels of care appropriate for different people. So a 28-day program, an inpatient program, or a residential program may be right for some people. Get this recommendation in terms of the most appropriate level of care to start your search. And from there, you can then search for treatment facilities and filter based on the elements that are important to you, like what insurance, what sort of payment they accept, if they have specific groups for specific populations, and a variety of other factors. And then you can compare those facilities side by side to see what fits your needs best.
Okay, I think it was a little bit cut off earlier.
I figured.
Yeah, care to just connect that with what you were saying and where you were cut off. So before talking about payer insurances, and it's okay.
Sure.
This is our reality. We work with
it.
I
know.
We live with it. It's all right. We're good. We're
I should really join my phone. I know. I should really log on to my phone next time instead of, because my phone has been so finicky. Anyway, so when somebody goes to the Atlas website, they can take this 13-question assessment that will let them know about the most appropriate level of addiction treatment for them to start their search. From there, they can search for treatment facilities that fit their needs. And they can use different filters to understand which facilities are best. So that can include filtering by the insurance the facility accepts, what sort of languages they offer, and if they offer groups for any special populations, among the different filters. They can then compare the facilities side by side to see what fits their needs most.
Sounds good. And
I froze again. Let me transfer.
No, you're fine. You're good right now.
Oh, good. I was going to say, because I can transfer to the phone audio if that's better.
We're good right now. So as you mentioned that for somebody that may not be knowledgeable of such, that
Perfect.
they're going to go ahead and think or use the 28-day number, but there's no magic number, if you may, because as you mentioned, it's an ongoing process of unlearning certain habits or way of life. And as you mentioned, there are different gravity and different substances. And just to highlight what you were saying earlier, that it's anonymous, and at the same time, it's just to go ahead and provide a little bit of guidance, especially for people that are scared to go ahead and reach out, and then at the same time of not knowing what to do. So that's great that you have that questionnaire there. I think somewhere, one way or another, you have already discussed this, or we have shared this already, but if there's anything else specific, and on this question is very important to me, the question of why, because ideally we have reasons, with legitimate reasons for anything and everything that we do. So why do we need the Atlas then?
Sure. So as I touched on briefly at the top, addiction is a disease that is in fact very treatable, and there are effective evidence-based treatments, but most people aren't aware of them. And finding treatment, even for those who work in the addiction treatment field, is pretty difficult. And it's pretty difficult to understand the quality of treatment and whether or not it follows those evidence-based best practices. So Atlas really provides a new service that isn't really, and that meets a need that isn't really met so far in the addiction treatment space, by offering a free, not-for-profit platform that's consumer-friendly, provider-informed, that allows patients, loved ones, anyone who's looking for addiction treatment to find the treatment that they need, to understand what level of treatment may be most appropriate for them, and then compare facilities based on evidence-based best practices. And so, we know that there is an ongoing addiction epidemic in the United States, and that, that may change from opioids to stimulants, and that it's probably likely not to go away soon. And especially with, as you mentioned, COVID and the number of people using substances during COVID. So it's our hope with Atlas that people will be able to easily find the care that they need and that fits their needs best. And that from there will be improved patient outcomes, that people will actually do better in recovery because they're given evidence-based care.
Sounds good. And this is the really nerdy side on my end. If you could explain a little bit more, how do you establish, how are you able to establish that these programs are evidence-based programs that are rather successful? Is it okay for you to speak on that a little bit more?
Yeah, absolutely.
Lovely.
So first off, something I should have mentioned at the top. So Atlas, there are existing addiction certifications or licensure programs, which essentially review all the aspects of facility and then give it a license or certification or accreditation, which states whether the facility meets certain standards. Atlas is not one of those programs in that it doesn't give kind of a single score, a single stamp of approval. Rather, it looks at all treatment facilities in the 6 states I described and just displays the quality of those facilities. So it allows patients, family members, all those I mentioned, to compare facilities on these measures. And now getting to your question about how do we determine the measures. So when we started off, we began with a substance use disorder quality committee. This committee reviewed existing measures in the addiction treatment space to understand what's already out there when it comes to figuring out if addiction treatment is good or not. From there, the committee distilled down a list, And then this list was refined in a process by the National Quality Forum, which is a national organization that generally sets the standards for quality measures in healthcare. And after the National Quality Forum did an expert panel, they had several recommendations. We took these measures and we distilled them down into 3 different data sources that we're using for Atlas. We have the treatment facility survey, which treatment facilities respond to about their practices, their services, their protocols, their staffing, and which is then validated by us. We have the patient experience survey, where patients or their loved ones can report on treatment they have received at a facility or at multiple facilities. And lastly, claims measures. And these are only displayed on those password protected portals of Atlas, so they're not publicly displayed. But these are to use insurance claims data from both Medicaid and private insurance to understand how well facilities are performing on certain metrics. So all of that data is collected, validated, and then displayed on the Atlas website. As I mentioned, that treatment facility survey and patient experience survey are displayed on the facility profiles. And the patient experience survey, once 20 reviews are collected for a facility, then it's displayed to ensure that the data are valid and that it's truly completely anonymous. And then those claims measures are displayed on the password protected portals.
Wonderful. Thank you for sharing that and satisfying that nerd itch of mine.
It's a good question. I know, it's definitely of interest. Like, how do we choose what is evidence-based quality and how we measure it? So it's a good question.
Thank you. All right. The next one that I want to bounce off of, you mentioned earlier that the providers are able to work with you guys as well. And care to expand that process a little bit further and how that goes and how you're working with them too?
Sure. So as I mentioned, there's this treatment facility survey. That's how we collect really the bulk of the data for Atlas. And this survey is administered at the facility level to all facilities in the 6 Atlas states. So Delaware, Louisiana, Massachusetts, New York, North Carolina, and West Virginia. The survey is not required for providers. There are different tactics that states and insurance companies use to encourage providers to complete the survey. But because it's not required, there's a number of facilities that didn't necessarily fill out that survey. And so what's really important about this is that in creating Atlas, we needed to really build up provider buy-in. We needed to build relationships with providers in order to encourage them to complete the survey when they weren't required to. Although it was a relatively short survey for the data it captured, it only took about an hour to 2 hours per facility. That's still a lot of a provider's time. So in implementing Atlas in these 6 states, we have our assistant directors of state engagement, of which I am one, and I have 2 colleagues. And we are really the boots on the ground, both physically and virtually in this COVID time, talking with providers, understanding what their needs are, understanding any concerns they have about Atlas, how we can allay those concerns, and what would make the platform most useful to them. And so really a large bulk of the work that we did was working with providers to understand how can we meet your needs and make a system that's useful for you.
And that's great that you're working directly with them and also with sort of indirectly with whoever the participants are who go through Atlas, right? So
yeah.
Okay.
Oh yeah, go for it. Sorry.
That you have that 360 perspective, that it's not only your platform and that's it, but you're working directly and indirectly with these individuals involved. But go ahead. What else did you want?
No, that's really exactly it. That we wanted to make sure that when we were building it, as you said, we had that 360-degree view. So we talked with providers, we talked with patients, we talked with insurance companies, state stakeholders, advocates, people in recovery, their family members, to really understand how can we create a platform that meets everyone's needs. And of course, it's very difficult to do that. Some people have different conflicting needs, but the end result is a website that's very consumer friendly, that was informed by providers, and that we hope will move forward quality in the addiction treatment fields.
I laughed a little bit when you mentioned that you're working as well with insurance companies, because, for example, for us, for our physical therapy practice, and that's why we're promoting physical therapy, not only because of our clinic, but how to work with pain management in a more natural way and not masking it and just addressing what the problem is. And I guess you will be able to concur that that's where the issue is, right? In terms of being dependent on such pain relievers or even those stronger ones. So yeah, how do I say this nicely? No doubt, working with insurance companies could be interesting, to say the least. And I understand it because that's their business. That's their business model. But it's amazing that you are engaging them with this. So how are you bringing them into this picture so that way we can all work together, that sure, they can have their own profits, that these centers would be able to function well enough with the reimbursements that they get, and then the people paying for these insurance companies for their, however they're paying for them, or through, or as you mentioned, through medical assistance or these private organizations, how are you able to integrate them? Whatever you can share.
I know. No, you raise a great point. That's certainly something that we've heard, whether it's opioid use disorder or stimulant use disorder, or even just getting treatment for another addiction. It could be alcohol, it could be gambling. A lot of people have said to us, well, insurance companies are really part of the problem. They're who are making it difficult. And so since we've heard this a lot, we knew that insurance companies were not only, part of the problem potentially, but also really a valuable part of the solution. That because insurance companies play such a big role in the practices that are used at different treatment facilities, in the sort of services that get rewarded in high quality care, we knew that we couldn't build this system without them, that it was really necessary to engage them as one of the key stakeholders. And that's what we see as so valuable about Atlas, is really bringing together all of those different stakeholders. So not just making a system that benefits providers, but also making a system that insurance companies can use to reward high quality providers and to reward high quality care more generally, and to follow evidence-based best practices. By partnering with different insurance companies, we can help them understand, these are the measures that we're using to recognize high quality care. And we think that it would be valuable for you to use these as well. And so that way there's alignment between with what insurance companies are looking at, what providers are submitting. And then there's also the opportunity for providers to benefit from Atlas vis-a-vis payers. And so what I mean by that is that if providers submitted data to Atlas and on the website it looks like they're very high quality, they can actually go back to their payer and say, hey, I'm high quality, I should actually receive a better reimbursement rate. And so in this way, it really allows more of a collaboration rather than the parties kind of fighting with each other. And then further, when we were doing the treatment facility survey, we collected information on what barriers providers are facing when it comes to providing high quality addiction treatment. And some of those barriers are related to insurance. So we'll be releasing a report later this year, which looks at what those barriers are, what the impact is, and also where there might be room for improvement, both in terms of policy and then also at the insurance company level.
That is super, and that gives me hope, and you guys are giving us hope, because you're absolutely correct. It doesn't have to be combative, if you may, of the providers, the insurance companies, and citizens of everyone practically. And no doubt is that being able to meet somewhere in the center, and I'm glad that you guys are really facilitating that process to make that happen. That is wherein we focus on quality of what's being provided that benefits the providers, because it makes them look good, that whatever they're doing is really helpful. The insurance companies, sure, they go ahead and get whatever money and making their board members happy, Sure. And then at the same time that they're able to reimburse well enough whatever these policy providers are. And then all of us paying these insurance and taxes and everything else, that we are more comfortable that all of these funding and money are going to these quality programs that do actually work. So thank you. Hopefully, are you planning to do physical therapy and medical practices, or?
Not yet. We're mainly focused on addiction, but who knows, somewhere down the future. Or, maybe this system will, inspire others to do similar work in physical therapy and different sections of physical health rather than behavioral.
Yeah. Okay. Now, you mentioned 6 states and possibly expanding. And from when I met you here with the recovery of oriented systems of care, is that I think you guys are trying to be able to be part of the Maryland aspect, right? So
yeah, that's one of the states.
Yeah, go ahead.
No, I was going to say that we're exploring kind of several different states for Atlas expansion. There's nothing announced formally yet, but certainly, we're having conversations with people in Maryland, in different states across the country, to see if we can really have a presence in these states and implement Atlas in those states. The goal is to really make Atlas a national system that anybody in any state or territory can access. We know that's going to take a little bit of time. We're right now a 5-person team, more or less, so we can't do everything all at once. But really, we know that people are really interested, and as I touched on briefly before, if they're interested in bringing Atlas to their state, they can certainly reach out to us at atlas@shatterproof.org and help us get connected, or we can talk further about how we can bring this to other states.
Okay, so, and that's where my question is. What can we do to help you out as helpful that you guys are already? So what can we do to help you out to bring you into the state? And at the same time, what are your internal processes, if you may, to make that happen? So how do we go about this? And obviously, I'm just talking about in Maryland, this is something that I could maybe help a little bit, but obviously for other states as well. And I understand that different states will have their different processes on how to bring you in. But yeah, what can we do to help, and what are your specific steps?
Sure. So with Atlas, the way that we go about kind of approaching new states, sometimes it's sparked by a conversation with the state. We know that they're interested in improving the quality of addiction treatment and helping people access the care they need. And so it's initiated by the state itself. Sometimes that conversation is initiated by a payer in the state. So for instance, currently in North Carolina, instead of partnering with the state agency, which is very busy focusing on Medicaid redesign, we've partnered with Blue Cross Blue Shield of North Carolina. So they're the ones that are funding the project, although they don't have a governance role. And then sometimes those conversations are driven by regular people who are just interested in having Atlas come to their state. And in terms of what that process looks like, we start by getting connected with the State Department of Health usually, and potentially the state governor's office, and starting those conversations saying, this is what Atlas is. We think that this would be really valuable in your state. We really continue those conversations, answer any questions that they may have. And then once the state is comfortable, we usually kind of sign a more official agreement. And then we begin talking with providers in the state, getting our boots on the ground, getting our hands a little dirty, building those relationships. And then, of course, then comes the data collection for Atlas, which we prepare providers for, then the data analysis. And in that time, we're working with providers to understand any feedback. And then comes the website launch. So that's a very condensed version, but all that is to say that what's really helpful for us is getting in touch with individuals at the state level, whether that is elected officials like the governor's office, or whether that's the State Department of Health, the Substance Use Disorder Bureau of that state department. That's what's very useful for us and really helps to drive those conversations forward and helps to bring Atlas to new states.
on that note, and this is what we will do here, because I've attended our lieutenant governor's sessions about this topic, and we were able to talk a little bit, and I know his right hand person, and so yeah, I'm dropping names right now. So would it be fine if I connect you with their office and see how that's going to go? And then Department of Health, at least here in our local county, I know of some individuals, but I guess, maybe I can reach out to them and see how they can hook you up in the state. But at least with the lieutenant governor, I know he's really doing good stuff about this, and they're rather responsive as well. So would it be fine that you are connected with them then in their office?
I will connect you to our Assistant Director of State Engagement, who
Okay.
is working on Maryland, Angad Buttar, one of my coworkers,
Okay.
and he can let you know kind of what would be most helpful. I think that introduction would be great, and he can let you know, this is what we've talked to the state of Maryland about, this is what we haven't talked about,
Okay.
because I think that would be really valuable, and I think that he would have a lot more insight. Unfortunately, I'm not the most knowledgeable one about Maryland in particular. I'd say that my colleague Angad is, but I am excited to be able to present in the state, to meet people from the state, and really to watch Angad grow and build those relationships.
Sounds good. So maybe we'll just chat offline or after we're done with this recording a little bit, just to clarify how we'll go about this. But again, at the end of the day, it's just, obviously this is going nationally, but why not worldwide as well, or how other organizations could borrow some of the things that you guys are already doing here to help their respective countries, because as you can imagine, that substance use is not only just a US based phenomenon. So just going back to that, yeah, so let's go ahead and talk online and offline after this, and how we can make that happen, because I think it's really beneficial on how we can have you here as well, and for all the other states as well, as you mentioned. So yeah, you have your own respective territories, of course. Just tell us on how we can make that happen. So we appreciate that. Ella, do you have any questions or anything you want to share with Carolyn? Or
I'm good.
you're good? Okay. All right. So thank you for joining us here, Ella. All right. So Carolyn, any other last thoughts on how we can go ahead and combat this situation? Because I know it's a different type of beast, but we're here to go ahead and help out. What can you?
Sure, great question. So I'd say that Atlas is really just one piece of a larger puzzle. And some of those other pieces Shatterproof is working on by helping to drive forward policy that encourages quality addiction treatment. There's also a lot of different work in the prevention space, in making sure that people with addiction have the resources that they need. And so I think what's really important at this point in the addiction field is just really bringing attention to the fact that addiction is a treatable disease. It can be treated just like any other chronic disease, and managed over time. And that those with addiction aren't choosing to become addicted, that really it's, just it impacts the brain like many other diseases, and that we can treat it. And so I think that that's really the first step in helping addiction treatment and addiction more broadly gain more attention, gain more understanding, and really helping move the field forward. And I think Atlas, as I said, is a small piece of that, is a step in the right direction. And hopefully we can break down the stigma that's kept addiction treatment kind of in the dark for so long.
Precisely, and thank you for that. And that's why we're doing this. That's why we have Carolyn for today's session. The reason being is, again, we are fully aware of our loved ones, neighbors, community members that's impacted by this in so many levels. And instead of keeping it in darkness all the time of people suffering as such. Let's bring some light into it. And once we bring some light and air into it, that we go in and help each other out. So one of the things that we consistently identify at ROSC is that you're not alone. And with that, we are here to go ahead and help and support each and every one of you to succeed of winning from this battle. And maybe I assume as one of the important things, Carolyn, that you guys are highlighting in this evidence-based program is the importance of assessment, correct?
Yeah, exactly. So there's that brief addiction treatment needs assessment. You know, as I said, many people don't know where to start with addiction treatment because it's really difficult to understand. Even those of us who work in the addiction treatment field don't know the best treatment for everybody right off the bat. And so with this assessment, patients, loved ones, anyone can get an understanding of where they should start their search for addiction treatment. Oh, sorry.
You're fine. And then when you go to these treatment centers, I assume that that's a huge part or component of what they're doing in order to identify exactly how they're going to personalize their rehab process, correct? I mean, is that something that I assume they would do?
Yes. Oh, perfect. You can hear me.
Yes.
So yes, that's exactly correct. That with the addiction treatment centers, you know, this addiction treatment needs assessment is just the first step. But when you actually go to receive treatment, your clinician will do a more detailed survey. They're actually based on similar structures, I would say. So the addiction treatment needs assessment that we have is based on the American Society of Addiction Medicine's continuum of care, these different levels of treatment that exist, and what the appropriate different symptoms are at each level and what the appropriate responses are. And so the addiction treatment needs assessment captures a small piece of that picture, whereas when you go to a treatment facility, they'll capture a much larger piece by conducting a more thorough assessment that also may involve a more detailed assessment of your health. It may involve some tests, but which will help to determine your personalized treatment plan.
All right, thank you. And on that note, it's difficult. It's a challenge, but again, we are here to go ahead and help out in one shape or form. And if you continue to be truthful of your respective situation as you answer these assessments, as you work with these clinicians, hopefully in the long run, this will just help you. This is not a matter of shaming anyone or demeaning anyone. Hopefully we'll go past beyond that right now and just really identifying and be educated of such situations. And Shatterproof and Atlas is here to go ahead and give that better direction. So please check their website out and share the word. So, all right. Anything else then, Carolyn? I know I already asked you for your last words, but any other thing that may have popped into your head?
No, that's totally fine. You covered it all. If you have any questions, just visit treatmentatlas.org. You can find our email address there, and I'm happy to answer further questions. And so don't hesitate to reach out.
Lovely. Thank you so much, Carolyn. And to everybody else out there, our thoughts are with you, our prayers are with you, and we'll continue to go ahead and work with this together. All right? Thank you.
Thank you for watching, and I hope you found this video informational and educational. Please share our videos and subscribe to our channel. If not, my dad will not give me dessert.